Hi, my name is Dr. Cirecie West-Olatunji, and I am professor and director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, I'm going to continue the series of 10 interventions for young children, particularly those who've experienced trauma. Today, we're going to talk about anatomically and culturally correct figurines. So this is number 5 in the series. We're going to talk about how to use these particular figurines. And notice that I use both. So one is, we often think about anatomically correct, but not always culturally correct figurines. We're going to talk about both of those. So what do you need? Obviously, you need the figurines. Now, when you go online, they range from about $25 to $35 for each one. And sometimes people want a whole family of them so that you can get them so that they represent various cultural groups. And I would recommend that. They come as figurines and they also come as dolls. So you could think about how you want to do that. Pretty much I would say you just need to order them. Another tool that you need is a list of probes. So what script do you need to create and able to find out what might have happened with this particular child. I don't suggest that you wing it. I think you need to create a script or a list of questions. So option 1 is that you create the list of probes. They could be questions or statements to elicit responses from the child. Option 2 is that you create a script and then create a scenario doing sort of dramatic play and then have the child to observe and respond. I would recommend that you record either of these approaches so that you can study the interactions and dynamics of the session and create notes. Now, the purpose of this particular exercise is, of course, as always, to create a safe and nurturing environment in order for the child to disclose. Also, what we want to do is to assist the child in creating dialogue so that they can talk about it without any triggers and feel comfortable in talking about what happened to them. It also helps us to do some form of assessment in which we get some idea about the child's knowledge and awareness of intimate body parts and sexual behaviors. So this means that you do need to study up on your knowledge of sexual development at all age levels. And oftentimes when we're in training, we sort of rush through early childhood stages and then go on to school-age children. So you'll have to go back and do a deep dive into early childhood and sexuality. It also provides us an opportunity to restructure and provide some restorative therapy where we re-educate children about appropriate touch and also about the privacy of one's entire body. And there's some good books that talk about that. One of those is a book called It's My Body that does that. So some of the benefits, it allows for child-centered therapy. It's also culture-centered. It's non-directive because it's open-ended, in which children either ask questions, make comments, or tell their own story. Again, it creates safety and it offers developmentally appropriate and culturally appropriate assessment. Well, some of the challenges, I think, start with us. So if we don't know a lot about early childhood development, we do need to go back and study that in order for us to create a script that will elicit the kinds of responses that will help us to increase our knowledge about what's going on. Also, we need to be prepared. Children who have actually experienced sexual trauma may be triggered by seeing the body parts or talking about it. So it may elicit a response, and we need to be ready for that. Therefore, the skill level on a scale of 1 to 3, in which 1 is beginner and 3 is expert, is level 2. I would suggest that the therapist needs to be an independently licensed mental health professional to be able to respond to any possible intense reactions that a child might have. Often you ask that I provide a case that illustrates the use of this particular intervention. I offer to you the case of a 4-year-old Afro-Caribbean boy who was referred for counseling by his paternal grandfather with whom he lives. Over the past 4 months, the child had been fearful of going to daycare and had been wetting the bed. Additionally, his speech had regressed to baby talk. These are common responses that children have after a traumatic event. And so we were able to use the anatomically and culturally correct dolls to be able to assist us in understanding where the child had been touched on his body. We were also able to find out who actually touched the child. So the child is able to express and articulate what happened, when it happened, and sometimes even who was the perpetrator of the actual behaviors. So now that you know how to use the anatomically and culturally correct figurines, I would say, why don't you develop a script or a list of probes, and then practice with a colleague, and then debrief. I would strongly suggest that you do this prior to using this intervention for the first time with an actual client. I am always interested in hearing how this works for you. Please email me, call, go on our website for more resources, or hit us up on Twitter, Instagram at XULA_CTSR. And I am very thankful to the NYU Bopes Library Digital Studio, as well as the Faculty Resource Network staff for all of their assistance in getting this video up and on screen. Thank you so much, and I'll see you next time.